Transverse myelitis, often abbreviated as TM, is a serious inflammatory condition that targets the spinal cord. This disorder can lead to a sudden onset of neurological problems, affecting movement, sensation, and even basic bodily functions like bladder control. The causes of TM are diverse, ranging from infections and autoimmune diseases to cases where the origin remains unknown. Historically, TM has posed significant challenges for both diagnosis and treatment, making it a key area of interest for medical researchers. The complexity of its underlying mechanisms means that each patient's experience can be quite different, which is why understanding the basics of TM is so important. In this video, we'll explore what makes TM unique, how it presents in patients, and why it remains a focus of ongoing clinical research. Recent research highlights that acute transverse myelitis, ATM, is not a single disease, but rather a syndrome with many possible causes. These include systemic autoimmune diseases, infections, and even post-infectious responses. The clinical symptoms often develop rapidly, with patients experiencing weakness, sensory changes, and issues with autonomic functions. Diagnosing TM relies heavily on advanced imaging, such as MRI and analysis of cerebrospinal fluid. Crucial part of the diagnostic process is distinguishing between idiopathic TM, where no clear cause is found, and secondary TM, which is linked to other conditions like multiple sclerosis or neuromyelitis optica. This distinction is vital as it guides treatment decisions and helps predict outcomes. As we move forward, we'll look at how these insights are shaping the way doctors approach TM in both adults and children. Children with acute transverse myelitis often present with symptoms that differ from adults, making diagnosis and management more complex. Pediatric cases can sometimes be mistaken for other demyelinating disorders, which adds another layer of difficulty for clinicians. However, studies show that children generally have a better prognosis than adults, with many experiencing significant recovery within 2 years. Recent discoveries about specific antibodies, such as those targeting myelin oligodendrocyte glycoprotein, are helping doctors refine treatment strategies and predict outcomes more accurately. Additionally, relapsing forms of TM have been identified, which means that ongoing monitoring and consideration of related conditions like multiple sclerosis are essential. These advances are paving the way for more personalized care and improved long-term outcomes for both children and adults affected by TM.